Thank you, Mr. Vice President, and thank you for your personal interest and support of our team over the last 72 hours as we worked on this critically important project. So as the Vice President said, over the past 72 hours, we have developed and are beginning to implement now a process and a program of testing that will enable Americans who are in need of coronavirus testing to be tested effectively and efficiently according to a few principles. Number one, we want to assure that those most vulnerable and those impacted are able to be prioritized. Number two, we don't want to do testing that in any way threatens the acute care system. In other words, we don't want people going to hospitals and acute care clinics where, number one, they could infect other people or subject themselves to infections. And number three, we want to balance the needs of across the entire healthcare system among diagnosis but also treatment. In other words, we want to balance the stress on the strategic national stockpile and all our commodities so that everyone gets all the materials they need. So what did we do? Because, as the Vice President said, last week's historically fast approval of high throughput testing, we are now in a new phase of testing. And you've heard Dr. Fauci talk about the new phase. So we're going from somewhat manual, relatively slow phases to a testing regimen that we can test many tens of thousands to hundreds of thousands of individuals per week and maybe even more. We will have 1.9 million of these high throughput tests available this week, with numerous labs, up to 2,000, starting to turn the lights on beginning this week and rolling out over the week. That is really a game changer for us because the back of the shop testing capability is there. The front of the shop is what we've been really working on. In order to get a test there, you've got to be able to swab individuals, get them into the system without completely paralyzing the entire healthcare system as we have. So with the emergency declaration, this was very, very important to us because it really enabled the historically effective processes of working and empowering states, federally supported state-led efforts through the normal FEMA mechanisms. So for the last 72 hours, representatives of FEMA from across the government and our Commission Corps have been working on joining the unique and unprecedented public health mission with the historically successful mission of distribution centers, places for distribution, the pod system of FEMA. Our public health service, we've already deployed over 1,000 officers in support of the coronavirus missions. That includes to the Diamond Princess, to the borders, to the quarantine stations, to the acute care settings where we're caring for nursing home residents in Seattle. So we have a very experienced group, and we brought these together. So what we've really designed and how we're working with the states, we have contacted all 50 states through the FEMA system, every single region, every single state, to understand where they are. As the Vice President said, some states are rolling out some of their own community-based testing. They need to be augmented. We believe we've created a model based on the public health and the FEMA system that is optimized, that can be used for drive-through or potentially walk-through. Each of these pod-based units, we believe, can screen 2,000 to 4,000 individuals a day for testing with all the appropriate personal protective gear, all the appropriate back end and linkage to the public health system, including testing. We know that we have the logistics to do that. We know we have the materials to do that. And again, this is federally supported state-led efforts. Many states need the full meal deal. They want dozens or of public health service officers to work in protective gear to actually test. They need supplies like protective gear. They need swabs. They need the logistical supports. Other states only need a fraction of that. They may have all the personnel, but they really need the know-how, the template, and some of the gear that we provide. We are going to start implementing this system this week in a number of states, primarily those that are the hardest hit right now or are on the rise, and the CDC advises us that that's when they need the testing. I want to emphasize again that we're focusing on two very important groups, and you'll hear this said 3 or 4 different ways, and the groups that really can be the most impacted or impactful in our outbreak. Number one is healthcare workers and first responders. This is very important for 2 reasons. Number one, we have to take care of the healthcare workers and responders because when America needs them, they need to be available, healthy, to provide the care that we all deserve. But it's also important that if they feel they have a risk of having contacted coronavirus, that we test them so they cannot spread that, for example, in long-term care facilities where the elderly are. And the second group would be the elderly. And we are classifying that according to risk as those 65 years of age or older who have a respiratory symptom and a fever of 99.6. That's a lower number than you've seen before because those who are older do not spike high fevers like children do, 104, 105. So you set the bar just a little bit lower. We do that because we know that they are high risk of bad consequences, and if they test positive, they can engage with their practitioner, telehealth provider, or get in the system to make sure they have just an outstanding outcome. So that is really where we are. We've made really unprecedented progress. You will see these sites rolling out progressively over the week. This is not make-believe. This is not fantasy. We've developed the model. We've talked to the states. We're focusing on specific locations now. We will start shipping gear, stuff, tomorrow. We will start deploying officers tomorrow and Tuesday, and we'll begin seeing these sites, in addition to the ones that are springing up now, implemented during this week. We will have the capability of testing tens of thousands of additional people through these sites every week, in addition to all the capability that's now going to be distributed in the 2,000 laboratories in the major central core laboratories. And I know you have a number of questions that hopefully in the question and answer session we'll be able to answer for you. But I think this is just a great linkage. I'm a pediatric ICU doctor. I take care of sick people. I know what happens when you get respiratory illness. The Surgeon General is an anesthesiologist who takes care of people who have respiratory difficulties and manages that. So we know how this works. We've been there. The most important thing we've worked on right now is making testing accessible because of the advances of the FDA and private industry to make these high throughput tests. Now we can work on the front end. With the emergency declaration, we have all the tools, and all of government has really come together with industry, not just government and states. It's really been private industry, the manufacturers to bring the swabs, the personal protective gear, the laboratory testing, the shipping, the fronts with Walgreens and Walmarts working as potential sites. This has been something in my mind has been unprecedented. The entire society approach working so intensely over the past, certainly over the past weeks, but incredibly on this project over the past 72 hours.